Hi everyone, I'm Dr. Derrick Bush. This is my research project, Hidden Pathologies, the Diagnostic Benefits of a CBCT on Craniofacial Diagnosis. I'd like to acknowledge my principal investigator, Dr. Kimberly Jones-Rudolph, as well. A brief overview of this project. So essentially we are taking six patients from Roseman University who have been found to have radiographic pathologies and comparing those radiographic pathologies with both 2D and 3D radiographic imagery. We then will compare the discrepancies, if any, found between the two and kind of giving a synopsis or explanation between the differences if there is any found. Just kind of diving into the history of CBCT imagery. Basically, it's gained a lot of popularity. Ever since it was the induction of it in the early 2000s, they've seen a large increase in popularity, and for good reason. There's been some studies shown that basically while using CBCT imagery, the increase of pathology found has increased from about 8% to 24%. And this includes like the ability to find more the presence of foreign bodies, dental abnormalities, airway anomalies, TMD issues, cervical vertebrae anomalies, and so on and so forth. And again, the purpose of this is not to discredit 2D imagery or lower in the orthodontic world, such as like a panoramic or a pano or a lateral ceph, but more to show you the benefits of using it in cohesion or with an adjunct of 3D imagery or CBCT imagery as well. Basically, what we will be doing is, like I mentioned previously, is analyzing 6 separate patients, all who present with visible pathology through CBCT or lateral ceph, and comparing the difference between a lateral ceph and CBCT imagery to see if there is a big discrepancy or not. So how we're going to go about doing this is, like I said, we're going to find 6 patients who are being currently treated or who have previously been treated here at Roseman University Orthodontics. We're going to present each case in a case report type format with multiple radiographs included in each case report. Each case report will include a standard 2D lateral cephalographic view and imaging obtained from CBCT imaging as well. We will then compare the standard 2D lateral cephalography to the CBCT imagery obtained and explain the relevance of why this matters to orthodontics and general dentistry overall. Basically, this is a short summary of some of our results. These are three out of our 6 patients right here. You can see we have A in the upper left, B in the lower left, and C in the upper right. They are respectively a 37-year-old Hispanic female, a 29-year-old Asian male, and a 37-year-old Asian male, all who present with different types of radiographic pathology seen. If we look in case A, you can see that she has an occipital bone spur. If we look in case B, we're looking at a calcified pineal gland. And if we look at case C, we're looking at somebody that has a tooth and incisal canal and also shows calcification in the vertebrae. So again, basically what we're doing here, you can kind of see a nice little overview, is that we have taken a lateral ceph for each one of these 3 patients, and then we've also taken CBCT imagery with different various cuts to be able to further see these pathologies that are going on. And basically, just to conclude with that, with its induction, 2D imaging allowed for diagnostic capabilities that greatly enhance patient treatment effectiveness, making the importance of traditional 2D imaging undeniable as an instrumental part of orthodontics and healthcare in general. These case reports elucidate that while pertinent information is obtained from 2D radiographs, 3D radiographs can more fully capture underlying pathology, more accurately show where teeth are within the maxilla and mandible, and illuminate respiratory pathways, all in an effort to improve the patient's diagnosis, treatment, and quality of life. So this is essentially what we will be doing for all 6 patients. As I've shown you, we have 3 here on this research. And they will follow that same format for the other 3, with each having a variable type of pathology, and then shown with a 2D lateral ceph and a 3D CBCT image cut. That is my research. Thank you all. I appreciate your attention on this.